We have guidelines that address the continuum of care in women's health, from everything from incontinence to pap smears. In every situation, we seek to provide the highest level of evidence that we can define for whatever the condition or procedure is that we're addressing. That is a complex question. And what I would say is that understanding when to appropriately screen for breast cancer requires a really in-depth understanding of the evidence, which our guidelines provide, fortunately. Everything from when to begin screening, how often a woman should be screened, and when to discontinue screening is variable based on an individual woman's values and preferences, as well as her underlying risk in these types of things. And so our guidelines account for all of that. And it's a really great question because if you look across the different societies that provide guidelines on like mammographic screening, they're all variable. And that can be really confusing for providers who really just want an answer. I've got a 45-year-old woman in front of me, what is the right answer for her? And so hopefully our guidelines help walk a provider or a health plan through how you might think about answering that question so that they can provide the best care for their patients. So for example, for mammography screening, we know that if a woman begins mammography screening at 40 years old, she can expect over her lifetime to have 1 to 2 false positive results. Like, what are the harms of having that result, a false positive result for her, both economic and also psychologic? And if we delay to 50, her risk drops to under 1. And so there are certain cancer screening guidelines for mammography that recommend delaying till 50 because of that. And what I think the truth is in that is a woman has to be counseled about that, and then she needs to have the opportunity to choose, understanding the statistics on it and recognizing that there are risks to screening earlier, but there are benefits, and there are risks to delaying screening, but your risk of false positive is lower. So, we through our guidelines try to inform people about those nuances so that they can counsel women appropriately to make the choices that are right for them as individuals. I really value working here at MCG where we're not tied to any particular bias or value. We say what the evidence is, and we try to teach the nuance, provide information about the nuance so that people can make informed decisions that make sense for the individual patient.